You are listening to Look Who's Talking. I am Cameron Minter. I am your co-host, and our host is none other than Head Start Director Jessica Coffey.
Good morning, y'all.
What's going on, Jessica?
Not much, Cam. Not much.
She's in the house today.
Yeah.
What's going on?
Literally not much. I don't know.
Well, you know, we're looming up on a big deadline.
And what?
I think it's by Friday. Our government may be shutting down.
Oh, yeah. That's a thing.
That's a thing. So, as our Head Start Director, is that going to affect our families and children?
Specifically, it will not affect our program right now. It will affect any program who has a project period or program year of October. And actually, that's about 10 programs throughout the country. So it won't specifically affect us.
So we dodged that bullet right now.
Yeah, we dodged that bullet. But however, we just want to stay on top of the news. I was watching the Today Show the other day, and they were mentioning the shutdown. And one of the programs they were talking about of cuts is Head Start, along with SNAP. So,
right.
It's affecting those programs that, really service people.
Right.
And help those who need those opportunities.
Yeah, absolutely.
So that's something that, we are keeping watch of. But as of right now, it will not affect our program. So we will be able to, go ahead throughout the fiscal year and be able to continue to provide services.
Right. Now, that brings us to, it may not affect us now, but in the future, we could be very well affected. So what does that mean? That means we need to get out and vote.
It's exactly what it means. Make sure your voice is heard. Every vote does count.
Yes.
I was just in D.C. last week at our Head Start Fall Leadership Institute, and we were able to talk to congressmen. We were able to lobby for Head Start and advocate for Head Start to say, hey, this is an important program for thousands of children and families, and we don't want our services cut.
Absolutely.
So, hopefully that'll work.
Right. And it's important that we vote. Just a note that Kentucky voter registration deadline is October 10th at 4 p.m. So it's important that we have a voice, not just presidential, but in every aspect that affects our children and our families. So it's really important. Impact that vote.
Because guess
there.
What? It's the president is the highest position.
Right.
However,
he's not making decisions.
Congressman makes all the decisions.
Right.
So it's those other elections are so much more important.
And even our state, local officials are important. So if you are not a part of the process, you're just a part of the decisions.
Yeah.
So let's get out there. Let's get registered to vote. And after that, I need some encouragement.
Do you?
I do.
I think I have some for us, Cam.
Let's have a coffee break.
Let's have a coffee break. Say to everyone is self-confidence is a superpower. Once you start to believe in yourself, magic starts to happen, Cam. So one thing I never leave the house without is confidence.
Okay.
I can leave my phone. I'll turn around and go back and
get that butt.
But do not leave the house without your confidence. It can just make your day a whole lot better.
It sure can. When you say confidence, I immediately think of Coach Prime. And he has always been extremely confident in who he is and what he can do. And he's not afraid to tell people about it.
Right.
Now, that's the part where people get upset is because it seems arrogant or
conceited.
Yeah. But when you're betting on yourself, and you're saying, I know what I can do, that offends people, because some people walk around this world and like, I don't know if I can do that. That may be too much for me.
I am not that person.
Come on.
Because I'm my own cheerleader. Like, back in the day, years and years ago, I was a cheerleader.
Okay.
But I'm like my own champion. And I hope that, even during some of the coffee breaks, we can encourage people, be your own champion. Like, applaud yourself.
Right. And you know what? If you don't, who will?
Right.
You know what I'm saying? You depending on somebody else to, recognize something. Recognize yourself.
Exactly. And it could be the smallest accomplishments.
Absolutely.
Applaud yourself for making it through the day. Let's start there.
Not fighting nobody, not punching nobody.
We are not choosing violence.
No violence.
We made it.
We made it through the day. Well, we have an exciting show today.
Yes,
we are going to be talking with our guest, Antonio Garcia, who is the Associate Professor of Social Work at UK. Antonio, welcome to the show.
Thank you for having me.
We're glad you're here. Your expertise is mental health, dealing with families and how they impacts our Head Start kids is what we're going to be talking about today.
So I'm excited about this conversation because I get to experience more than Cameron what's going on in our classrooms.
You don't know that for sure.
Cam,
you just call me out.
You
like
don't.
that.
You don't walk upstairs.
Right. Okay.
Okay.
Sorry.
So, just what we have seen, the evolution of just behaviors in the classroom through COVID has dramatically increased. Do you have any idea of why that's happening?
Well, if you think about what's happened in the past 3+ years, our kids have gone through a lot. We pulled them out of school to hopefully keep them safe, to keep them from actually getting COVID. We threw them back in the classroom.
And they really did throw their kids in the class.
Yes.
They were like, take these kids, we're leaving.
Right. But think about that time when, the schools were shut down. Parents were going through a tough time too.
Yep.
They were managing their careers. They were managing their kids at the same time. I was in the same boat. And I can speak just for myself. It was quite challenging to grapple with all of those demands. And I think one of the key lessons we learned is that Head Start schools, our education systems are so imperative. They provided support in terms of not only for learning and growth for our kids, but also for us as parents who are working and trying to, provide for our families.
Right.
And so our way of living for parents, for kids, dramatically changed. And it's no surprise that's going to leave an imprint on the well-being of our kids. It's going to take time for them to adjust.
Exactly.
One of the things that we learned during the pandemic is that we're almost essential workers, because if you don't have a place where the kids can go, then the parents can't go.
Right.
And so it was imperative to get classrooms back open, but there was, so many different things that were being weighed. And I think when you were experiencing, you had just moved. Is that correct?
That's correct. Yeah. So we were going through just a lot of transition. And if, for example, many parents, held meetings via Zoom, and then in the background you got screaming kids and kids who need to be fed. And so it's just dealing with all of those challenges. And, and now with kids, returning to the classrooms, they have to readjust. It's like they have to reset in terms of what the new norm is. And that just takes an adjustment and a lot of patience, I think.
Right. So I'm interested. I know that you've done research on like racial disparities in serving children. Can you talk a little bit about that?
Yeah. So just for background, I actually used to be a CPS worker in Washington State. And that involved responding to reports of abuse and neglect.
Yeah.
And through that experience, I realized that a lot of the kids were falling through the cracks. And I was putting sort of Band-Aid solutions on these huge public health concerns, ranging from crime, poverty, social inequality, trauma, abuse, neglect, and so forth. I mean, a laundry list of public health concerns. And I felt that, at least in that role, seeing what I had seen, I had to pursue higher education, pursue a PhD to at least use research as a vehicle to inform how best to eradicate some of those public health concerns. And through my research, I really focused on access and use of effective mental health services for kids of color in the system. And through that research, I found that indeed Black and Latino kids were less likely to receive mental health services to address risk factors. And so then I started to wonder, well, why are we seeing these patterns happen? And so through some complicated, models and so forth, I found out that if you take into account things like poverty and organizational dynamics and leadership, that those disparities go away. What does that tell us? It tells us that we need to address poverty, social inequality, and restructure our systems to be more conducive to adapting or implementing evidence-based interventions for kids of color. So we know what needs to be done. It's just, are we going to do it?
Yeah, you mentioned something that I'm interested in. You were a CPS worker. And like I've been trying to, we've been doing a good job in trying to get our teachers to realize neglect is different than poverty. So, being concerned that a family doesn't have living room furniture is way different from a parent not being able to provide,
Exactly, yes. I think it involves, educating and training educators and other folks to recognize what are the signs of abuse and neglect. And oftentimes our own biases in terms of how we think we should raise kids comes into play in that process.
My grandmother was a teacher in Louisville, and she, they used to call it BD, behavior disabilities or something. She that was her specialty that she taught. And she had such bonds with the kids that were beyond teacher-student. And she would be there for them in ways that opened my eyes. So, like, she would bring meals and stuff like that because the kids weren't getting fed at home. Or the kids were, once they left school, they would go home into an environment that just wasn't conducive for their learning. So there were so many different things that she opened my eyes to not look at the problem that's being presented, but try to get to the root of why that is happening.
Right, exactly. And it just reminds me that, think about Maslow's hierarchy of needs. Kids need to be fed. They need those basic needs in order to learn and grow and develop. But, in terms of really, trying to distinguish between poverty and, neglect, with neglect, it's that intentional harm.
Exactly.
With poverty, there's actual need. There are needs that need to be addressed.
Exactly. And that's why, through the services that we provide, we've been in contact with, just all kinds of types of situations. And that's why, we have washing dryers here. Yeah. Because we deal with some parents who have to make the decision whether, am I going to pay rent or do I need to buy this washing detergent? I'm going to pay rent because it's more important that we have a roof over our head.
Right.
And that's why, we provide opportunities for our families to, if you don't have a washer and dryer, guess what? Use what we have in this center.
Definitely. And those little things make such a difference. And oftentimes we don't realize that.
Yeah. We have a mobile food market, but Kim, I'm trying to get a mobile washer and dryer.
Ooh.
You think it can happen?
Oh, that would be great. That would be awesome. I've seen some of that.
On wheels.
Yeah, I've seen some of that, especially when there have been disasters and show up, But we're going to continue this conversation. We want to know some of the results of your research on the things that bring greater disparity. All right? We'll be talking once we come back. You're listening to Look Who's Talking.
This past year has highlighted the strength of Community Action Council. Every day, our staff works together to help families recover from this crisis. We're educating children at home and in person, helping parents who lost their jobs, and helping households avoid eviction. Our work at Community Action Council has never been more important than it is right now. So why not join us? We have employment opportunities requiring a range of skills from entry level to advanced. Apply online at commaction.org.
I love Head Start.
Children love Head Start, and you will too. Community Action Council's prep academies are hiring now. Head Start is an early childhood education program for children from birth to age 5. Help us give more children the Head Start advantage.
Teachers, what are you waiting for?
Join our team of dedicated education professionals. Apply online today at comaction.org. What are you waiting for? You're listening to Look Who's Talking, and our guest today is Antonio Garcia. He is an associate professor at UK, and we've been talking about disparity in education and just the results of your research. What can you tell us about those results?
Well, over the course of the past 10 years, I've really focused on how research could be used to better enhance practice within systems, across different systems, whether that be in child welfare, mental health, schools, and so forth. And so one of the key drivers to success is essentially making sure that our systems, our organizations that serve kids and families are ready, prepared to implement evidence-based interventions to mitigate some of those risk factors and promote positive psychosocial outcomes. And a key sort of theme across all of those studies and the projects is, again, leadership, innovative leadership, transformational leadership, and the willingness to innovate and engage in new practices that are evidence-informed and culturally relevant. But through that research, I've done work with interviewing kids and families, foster parents. But I realized after sort of looking over my portfolio, so to speak, I haven't really captured the voices of fathers. Mm-hmm. And as I looked through the prior research that's been done in the area, it's rather limited. Mm-hmm. So that just goes to show that there's a huge gap in really trying to identify ways to better incorporate healthy father involvement in our kids' lives.
Yeah.
That is a big concern that we have in our Head Start programs, where we have a program for family engagement, and we even have one specifically for fathers. So we know that the prime years of learning are 0 to 5.
Right, and that makes me think about, we do have quite a few fathers who are active in their children's lives, but when it comes to the parents not being together, we see that's when it's harder for our parents. And then especially when we give out information, we usually give it to the primary parent, but then, you have the secondary parent, and that parent didn't get the information and they don't know what to do, and they're picking up the kid today. And, we are trying to find better ways to make sure that we involve both parents, because, again, it's so important especially that father.
That's great to hear, because what we do know from the research is that when fathers are equally involved, kids benefit. We see better outcomes, across the board in terms of their mental health, their educational outcomes, prevention of abuse and neglect, and just more maternal support when they're involved. So it's just a way, father involvement is a way to sort of address some of those public health concerns that I raised earlier. That if they're involved, we see a lot of those risk factors decrease.
Gotcha.
So mental health has really been, in my opinion, ratcheted up since the pandemic. That's all we hear about is getting your mental health in order. Can you, just give us some insight on why you think that is occurring?
And that makes me think, what is the climate? Like, we talk about mental health climate. Well, what's the temperature? Because I don't know. What's the climate?
Right. Well, I think what COVID did is that it helped sort of reveal what's under the carpet, so to speak. And I think during that time, a lot of that trauma resurfaced. Some have said that the whole COVID pandemic was a traumatic event for many people. And when trauma happens, oftentimes all of those other traumas sort of come to the surface.
Right.
And so that's a lot to handle for any one person to grapple with. And I think that's why we're seeing just at least more discussion around mental health concerns and trying to, normalize it instead of stigmatize it.
Yeah.
We're so quick to say, go to your physician and get this checked out to promote physical health. But the same mentality doesn't apply in our society for mental health.
Right. And you know what? You said, COVID was traumatic. COVID was traumatic. Yeah. And as a single person who I live by myself, I felt myself like, oh, what am I supposed to do with my time? Because everything that I would normally do to emote, I couldn't go to those places. I couldn't do it. I had to be by myself, with myself. Right. And I could only imagine how a family was during that situation, during that time period.
Right.
Yeah, we kind of joked before the show and said that post-traumatic stress, when we think about it, because I think you were saying that it was a blur, what all the details, and the details of 2 years is gone out of most of our lives. But I think it just opened up wounds or opened up areas that needed to be addressed.
Right.
And now that, something traumatic has happened that has got us on a better trajectory. But you also said that most minorities, there is a big disparity in receiving help for mental issues.
And a lot of it has to do with lack of trust with our systems. In other cases, it's just a stigma of reaching out for help. And a question of whether or not the services that are available are culturally relevant. Those are the biggest barriers that I've seen through my research is this, is there a compatibility between, what I need and what's out there for me?
Through the past few years, have you seen an increase of people reaching out or like understanding mental health, mental therapy, wanting to get, counseling or anything like that? What have you seen when it comes to, and the minority population receiving or...
Right. So I think in, talking with different leaders across different systems, I think there's more conversation happening, definitely. They want to make sure they have the tools, the resources, the capacity to motivate their staff to engage with their clients authentically and in culturally relevant ways. And I think part of that process involves educating our clinicians, our leaders, that many of the existing interventions out there have actually been tested by or within minority populations. Right. But there's this bias that they haven't. And so as a leader, I may question, is this practice applicable? Are they going to buy into this? But But first and foremost, in my research and my work, I go to organizations. I don't tell them which intervention to implement. They are the experts. They have a firm grasp on what they need, what their staff need, and what their clients need. Mm-hmm. I'm just there to support them in implementing whatever they decide to implement. But in that process, I encourage them to really sit down and think about what are the issues of concern. What is your target population? Will this intervention, will it address the risk factors that you're really trying to address? Mm-hmm. So it's just a lot of pre-planning rather than sort of, I'm just going to pick this intervention and go with it.
Right. Have you seen an increase in minorities getting into the profession?
I think, at least in our programs here at UK and even, across the country, yes, definitely. I see a lot of bright students of color who are motivated to address the mental health concerns.
Right.
And as an avenue to promote educational outcomes.
Right. My background is nutrition, actually. Yeah. And I did a research project on just the disparities of nutrition in African-American women living in low-income housing. And that brings me, that reminded me of just, you mentioned trust being a big part of why people don't seek, help. And I found that to be the same with nutrition. They were more prone to listen to me than to my Caucasian counterpart that didn't understand the culture or understand how I live, Do you see that, or do you think that's a part of the distrust factor in?
Definitely, yes. In my work, when I try to engage clients or leaders, I try to identify champions who could be a voice for that community. Mm-hmm. And I partner with them.
Yeah.
So all the work that I've done is really, it's a testament to partnership and team science, really. Mm-hmm.
So what are you doing now? I understand you're doing something. You're constantly doing something, but now your research is taking you to another path.
Well, I think it's on the same path. It's just a pivot, I think, in really trying to figure out how we can better engage fathers authentically. As I mentioned, when fathers are involved, we see better outcomes for kids across the board. And thankfully, here in Lexington, Kentucky, David Cozart has been a true leader and champion for fatherhood.
Right.
Yeah.
And so I connected with him 3 years ago to work on this project. And part of that project involved evaluating his services. A lot of his work is devoted to delivering father-centric services and programs in our community. He wanted to get a sense or get a pulse on whether or not what he was actually doing was effective. Mm-hmm. So we partnered and we examined, the acceptability and the feasibility of a 24/7 dad parenting program. And through that research, we realized we need to address some really complicated structural systemic issues. Mm-hmm. In my interviews that I conducted with fathers, I learned that many of them just didn't feel valued or didn't have a seat at the table during case planning for their own kids.
Yeah.
And this happened, in school settings, in child welfare, and so forth. So it's about how can we better equip those systems to even think about involving the father at a meeting.
Yeah, that's important.
So so a lot of the narratives that I listened to involved, I just want to be involved. I want a seat. I want a chance to comment on what I think about my own kid. And so a lot of those pieces are just missing right now because the go-to seems to be the mother in most cases.
Right. So have you all come up with any recommendations as of yet with your study?
Mm-hmm. So with the study, we took all of the interviews we conducted with fathers and actually the system providers that work with kids and families. So we interviewed numerous providers representing child welfare, probation, schools, and other systems. And through all of that data, we actually developed a training curriculum for providers statewide with some tools and some resources on how to actually engage in father-centric healing practices.
Well, that's awesome. That's something that we can look forward to and figure out how to, bridge this gap. There's a gap that's affecting our children and our families, and it's great to know there's someone out there is doing some research to try to get some answers.
Well, thank you.
We like to thank you for being on the show. We really appreciate it, and we appreciate the knowledge that you bring to this subject. That's the show. What you got?
That's it.
That's it. That's
I'm
it.
excited about, just what we have coming up with our father engagement, and just listening to Dr. Garcia. I think that we are on the right track, but it would be great to be able to partner and, see how we can just make the relationships,
How
vibrant.
can we learn more about what you're doing?
Well, I'm actually, if you just go to the UK website and search engine just Antonio Garcia, I'll pop up.
All right. Thank you for being on the show.
Thank you.
You have been listening to Look Who's Talking. Tell your friend, tell your family, tell everybody about this show, and we'll be checking you out the next time.